Hello, I am Professor Jean-Luc Baligan. I am a cardiologist and I also manage the Institute for Experimental and Clinical Research at the Université Catholique de Louvain. I have the great pleasure to introduce our new project aiming to reduce heart failure. During my consultations, I and my other colleagues meet many patients with cardiac dysfunction for which no treatment is effective. These patients suffer from heart failure. In the early stage of the disease, it is especially during a physical exertion or when another disease occurs that they experience a shortness of breath, fatigue, and other discomforts. But later, even during light work, they suffer from these symptoms. We can relieve their symptoms, but we cannot stop the course of their illness to severe heart failure or even to their death. This situation of helplessness about the deteriorating state of the disease is distressing. A particular form of heart failure is called heart failure with preserved ejection fraction, also abbreviated HFpEF. This disease is common among the elderly, especially in women. To better understand this disease, let me explain how the heart works. The heart is like a pump. Therefore, it has a blood suction phase and a blood ejection phase to the peripheral organs from its left side, called the left ventricle, and to the lungs from its right side, called the right ventricle. In heart failure with preserved ejection fraction, the left ventricle of the heart can no longer ensure properly its suction function, leading to a defective filling. Indeed, when aging, the heart becomes less flexible and the tissues thicken. Although the heart can still eject blood effectively, it no longer fills entirely, which cuts off the amount of blood ejected. This results in an oxygen deficit in the tissues and peripheral organs, so the patients are very tired and out of breath at the slightest effort. The disease is called heart failure with preserved ejection fraction and is usually due to a hypertrophy of the left ventricle. The situation is worsened by risk factors such as obesity or hypertension. In my laboratory, researchers have discovered that a particular receptor to catecholamines, which are some stress hormones, was present in the heart. This receptor is called Beta3 adrenergic receptor, also called Beta3 Indeed, the heart is a muscle composed of cells called cardiomyocytes, and in the case of left ventricular hypertrophy, these cells are larger than usual. Researchers at IREC have identified a specific receptor on the surface of the cardiomyocytes. This molecule at the cell membrane surface is called Beta3 adrenergic receptor or Beta3 Experiments showed that if the cardiomyocytes were exposed to drugs activating the Beta3 adrenoceptors, these drugs would bind to the Beta3 receptor, which would reduce the size of the hypertrophied cardiac cells after 2 weeks. Motivated by this success, we would like to attempt to replicate these findings in patients suffering from a cardiac hypertrophy and therefore at risk of developing heart failure in the future. The project is called Beta3 LVH, standing for left ventricular hypertrophy treated by Beta3. This is a project funded by the European Commission that wants to improve public health. We are 12 partners spread in 8 European countries. Actually, the Beta3 receptor is also present in the bladder cells. Some people suffer from bladder disease that force them to urinate frequently or may cause them incontinence. The drug which activates the Beta3 receptor is marketed under the name Beta3. When the patients suffering from incontinence receive Beta3 agonists, their bladder relaxes, which avoids micturing too often. The Beta3 is already on the market, so its side effects are known. In this clinical trial, we plan to enroll 297 patients with cardiac hypertrophy to check whether the size of the left ventricle decreased after taking Bet-Miga once a day for 1 year. During that year, they will have to go to the hospital 6 times for medical examinations. There are several tests to be conducted to assess the efficacy of the treatment. The first is an echocardiogram. This is a medical imaging technique using ultrasound, permitting us to collect information on the size of the heart and the blood volume passing through the ventricle. We can then calculate important filling parameters of the heart chambers. A magnetic resonance imaging, or MRI, will also be performed. This technique allows 2- or 3-dimensional views of the moving heart. After analyzing these images, the mass, volume, and ventricular function can be calculated. MRI will also allow us to evaluate ventricular hypertrophy, which is the criterion considered in this study. The effect of Bet-Miga on the exercise capacity will be measured by a stress test, also predicting the quality of life of the patient. Indeed, we will be able to quantify the patient's state of fatigue when the patient does physical exercise. Besides the beneficial effect of Bet-Miga on heart size, the drug could have benefits on the vessel wall. To check this, a blood test and an additional test of no more than a quarter of an hour will also be conducted. Experiments with Bet-Miga also show that it could transform the white fat used as storage in brown fat, burning calories. This could fight against obesity and thus reduce the risk factors leading to heart failure. This is why we will also evaluate this factor. To this end, a positron emission tomography or PET scan will be performed. The PET scan allows the tracking of the metabolic activity of organs and thereby the localization of the activation of the brown fat. During the study, all the results will be collected and centralized. At the end of the study, echocardiography, MRI and PET scan images will be correlated with the exercise capacity tests and the blood tests to interpret the results of the cohort of patients. With the European partners, we will analyze these results and we will decide what are the conclusions of the study. At this time, we will be able to tell if the drug activating the beta-3 receptor can effectively reduce the cardiac hypertrophy, as we hope. We will unveil the conclusions of this study on our website, the websites of our partners and the media. The results will also be shared in international cardiology congresses. If you have hypertension and you have some risk factors for developing heart disease, talk to your doctor. If you wish to receive information about this clinical trial, you can join us on social networks. You can also visit our website where you can contact me. Thank you for your attention.